I know you know these probably, but I'd like to at least hit them for you. The circular muscles on the face, the muscles around the eye, the oculi, orbicularis oculi, the one around the mouth, the orbicularis oris, another important one. These are circular muscles. Also, it doesn't show real well on here, but the muscle for chewing, the masseter muscle, the muscle right here, right? That's one I know you need to know. And a couple of other ones. There's a better view of it, but the temporalis muscle, will be, that's, obviously you know where that one is. And, here's one that we don't have a model for, but I know you know where it is because you've been asking me about it. It's this very superficial flat muscle here, right, kind of right under the skin, and that's the platysma. And so here it is right here. It covers a very obvious muscle, the sternocleidomastoid. But this is the platysma right here. There's one chart over there, I think, that has the platysma shown on it. But strangely enough, it's not on any of our other, even half of our other charts that sometimes we'll have it superficial and deep. But I did want to point out where the platysma is. But on the face, the orbicularis muscles, platysma, there's a bunch on here that we don't do, like the zygomaticus muscles and all that kind of stuff. So that's one view. The other view, well, you can see the masseter here. Here's the temporalis muscle, another also muscle involved in movement of the mandible. And here we've reflected back the platysma, and you can see the sternocleidomastoid. Okay, and better view. I like this. This is a good one. So here's the masseter muscle. It's a little spinal process here. The masseter muscle and also the temporalis muscle. So those are, what do we have those on? Well, the mannequins back there have it. Maybe that half head back there on the between the leg and the spine. I think that might have it. The half head, sagittal section head. But anyway, that's a good one. Oh, this is a cadaver dissection of the sternocleidomastoid. You can see it. It's a real obvious muscle. Let's see if anybody's this muscle right here. And I think our cadaver dissection, it's pretty well exposed there as well. Our cadavers, we've got a male and a female. The female is the one I think has been worked up a little better. The arms have been pretty well done. The chest has been done. The ribs have actually been sawed or cut through, so you can actually kind of pull the thoracic cage off, so to speak, and see the internal organs, stuff like that, at least to a certain extent. Not a whole lot's been done on the legs, as I recall. Maybe a little bit, but well, anyway, but I know the neck has been done. Oh, yeah, here's one last night that it came up. I was like, well, what model are the erector spinae muscles on? And in fact, they're not. Okay, so I guess you don't have to worry about those on the exam. But this group of muscles here, you can see they're deep muscles in the back. And just the name tells you what they do. They help straighten the spine. And these are the muscles that, sometimes or oftentimes, whatever, get injured when we don't, use our, like none of us do. We don't use our legs to pick things up. We use our back, and everybody's been guilty of it. Supposed to bend down and pick that thing up, with your big muscles of your legs, rather than like bending over at the waist and picking it up. Then you go, oh gosh, hurt my back. Well, these are typically the muscles that get involved, the erector spinae group. So they are muscles which move the spine and make the spine go straight up. Anyway, you see there are very deep muscles along the back, and we just don't have any deep, really representations on any of our models or anything that can show you that. So anyway, I definitely want to show you where it is. A couple of other ones too that are kind of the abdominal muscles are really good on a couple of these figures. I want to show you those as well. Well, actually, let's look at here. So obviously the pectoralis major. You can also see the serratus anterior. You know where those are in your calf. There are these muscles right along here. When you look at the stomach muscles, of course, and take off the connective tissue, these are the rectus abdominis. The word rectus means straight, so they're the muscles that go straight up and down. And they're on our mannequin models, and I know you've seen them well and nicely exposed on many of the cats. In humans, we have these little things called tendinous inscriptions that sort of divide the rectus abdominis into sort of little packets, the six packs, right? Anyway, and then, so the rectus abdominis is superficial, so of course is the external oblique. If we reflect back the external oblique, then we have the internal obliques. And the deepest ones, you can't see it very well on this particular picture, are the transverse abdominis, but I got a picture I'll show you. One other thing on here, actually, nobody's asked me about it yet, but I'm sure somebody will. The intercostal muscles. These are the muscles between the ribs. And there's two sets of intercostal muscles, and here's how it works. It's like the internal and external obliques. There's internal and external intercostals, and they lay across one another at different angles. So the external intercostals, are on the surface, and below them the internals. They're very thin. We used to try to do it on cats, but they're so small that it's really hard. But if you're looking for them on a model, let me just grab it. Let me go back here and grab. I think this is what this is what I want. On this chest wall of our mannequins. Okay, here it is. So obviously, these are the ribs, and you can see. You can see there's one sort of layer of muscles running in this direction, externals, and another one kind of running in that direction, internals. The intercostals, just between the ribs. The intercostals can be, although not extensively involved in breathing. We'll talk a little bit about the muscles of breathing, but the most important muscle of breathing is just the diaphragm. The intercostals are involved marginally, as are the abdominal muscles. But anyway, so here's we got this. There's one more thing I want to say that's on this one. This is a good picture. Okay, so if we look at this one. So here's, obviously this is the back, this is the front. So look how the layers work. You can actually see this on our mannequins as well. So here's the rectus abdominis on the front, and then the external obliques, the internal obliques, and transverse. So they lay just on layers, just like that. And I know in the cats, the transverse are kind of tricky to find, but I've seen a couple of cats look real good. So this is what I like this particular picture here. Now, here's the rectus abdominis, and they've got a little bit of fat on this one, so maybe this person is not showing a really good six-pack. Anyways, this is a cadaver picture of it. And actually, our cadaver abdominal muscles are, they're pretty good. You can see the internals and externals pretty well. Okay, all right, that's good. So some of the appendicular muscles, we don't need to spend a lot of time on these because I know you know them already. This is obviously one side superficial, one side's deep. The trapezius muscles, the big, large muscles that cover our back, they actually sort of are in three sections, here, here, and here, sort of, anterior, middle, and posterior. The deltoid, we'll talk about the muscles on the scapula separately here in just a second. We talk about the rotator cuff muscles, because you need to kind of know what those are. The rhomboids, just like they are in the cat, between the shoulder blades, between the scapula, and also, here's an important muscle, you can just tell what it does. The levator scapula elevates the scapula, moves it upwards. And I know you've seen that in cats. It's a fairly obvious muscle, kind of in the general area with the deltoid group with your cats. Cool. Well, let's see. We really cut it down here. Here's the pectoralis minors, which lay under the pectoralis majors. See the intercostal muscles here again on this particular one. Here's the biceps on this one. These other pictures here show origins and insertions, and we're not worried about that. I'm looking for the serratus anterior picture that I like. I'm sure it'll show up. Anyway, this is just sort of a whole body picture. So here's the pec majors, pec minors. Serratus anterior run right along here. The serratus anterior muscles are muscles which are